All right, well, good afternoon, everyone. We are going to go ahead and get started. Again, my name is Amanda Sternberg. I'm with the Homeless Action Network of Detroit. So today we are going to be talking about the FY 2023 Request for Proposals, or RFP, that the Detroit CoC has recently released for new CoC project funding in this year's competition. So if that's what you were hoping to hear about, then you're in the right place. So just to get us started, before we get into kind of the overview of the presentation, some quick housekeeping tips. We are recording this webinar, so the recording and these slides will all be posted to HAND's website within a few days. Attendance at this webinar is not required in order to submit an application. So if you are watching this recorded version, or if you have to hop off early, that will not impact your ability to apply. We certainly encourage everyone to stay for the entire webinar or watch the recording, just because it'll be really helpful information. But again, it was not a requirement in order to apply. So just broadly, what we're going to be going over today, you see it on the screen there. We're going to be talking about the application process, the types of projects that you can apply for, how much funding we anticipate having available, some of our funding priorities, populations of who can be served within these projects. We're going to be going over some project and applicant requirements and some performance expectations. Then I'm going to then walk us through the budget spreadsheets that are required with your application. We're going to look at the PSH budget spreadsheet first, because that one's a little different and a little bit more, ask for some more information than the budget spreadsheet for other project types. So we'll spend some time going over those. And we're also going to take a look at the online application portal. That is one of the things that is different this year. For those of you that may have applied in the past, you would have downloaded a Word document, filled it out, and sent it to us. This year, we're using an online application portal. And so we will be spending some time going over some basics of that, the use of that portal towards the end of the webinar. Everything I'm going over is in the RFP that we published last week. So you definitely want to read that document, because that will be going into more details than what we're able to cover here. So a couple of caveats. So I put these slides together last week, and the first bullet point that says the 2023 Notice of Funding Opportunity is not yet released. HUD actually just released the NOFO about an hour ago, so that bullet point is obsolete. However, even though the NOFO is technically out, it doesn't really change anything that we're talking about here today. Still don't know exactly how much funding we have available. And, to be honest, I've not had a chance to read the NOFO yet to determine if there were any additional requirements or expectations from HUD. So once I get a chance to read it, if there's any additional adjustments that need to be made to our local application process, we will certainly make those adjustments as needed. So the materials that I'm going to be going over today are all posted on HAND's website. I will drop that link in the chat a little bit later on as well. If you don't already have it, would recommend that you go to it and kind of bookmark that link. The RFP is posted there. This recording and the slides will be posted there. I referenced earlier, we're going to be walking through some budget spreadsheets. Those are all posted there, as well as a CAM governance letter of support request, which we'll talk about in a bit. And then lastly, the link to access that online application portal. It's all posted on our website, so you'll want to make note of that web address and keep that handy. So applications, new project applications, they are due by 12 o'clock noon on August 4th. So that's just a little under a month. So just please be mindful of that deadline. It is a noon deadline, 12 p.m. noon on August 4th. Again, everything's going to be submitted through the portal. We anticipate that the Detroit CoC board will be making decisions on new projects in September. So again, now that we have more information from HUD on the application timeline, we'll may be able to firm up some of those dates. What's not changing is the due date that for these applications, that is August 4th. I should have mentioned this at the top as well. As I go along with this presentation, feel free to drop questions in the chat box. You can also feel free to raise your hand and I can, take you off of mute as we go along. So don't feel bad about interrupting for that. Okay, I want to take just a few minutes to walk through what the local application process looks like for new and expansion projects. And I'm using this phrase new and expansion, and in a few minutes I will kind of define what I mean by that. But for folks for whom this may be new, maybe you've not applied for CoC funding before, just want to walk through kind of what this process looks like locally. So the first step to this process is that the CoC, the Continuum of Care, releases a local RFP and application. So that is what HAND has done. It's part of our role as the collaborative applicant. We have developed and released that RFP and application. So that was released last week. And so we're all now in that process of reviewing that RFP. Agencies will be submitting their applications. After those applications are submitted, we will have a committee that will review and evaluate those applications based on the evaluation criteria given in the RFP. Based on that review, the CoC, so the Continuum of Care, and this is our CoC board, will make a decision locally on which projects we want to submit to HUD. So that's the board decision that we will be taking place in September. So after our CoC board makes that decision on what to submit to HUD, again, based on the review and the evaluation of the application, those projects are submitted to HUD. We have to rank those projects in a priority order. The policies on developing those ranking orders are still under development. But again, the projects are then submitted to HUD. If your agency is selected to have a project be submitted to HUD, I will work closely with you to go through that process of actually getting it into HUD. After projects are submitted to HUD, HUD makes the final funding decision. So this is really, I think, the point that I wanted to emphasize is that at the end of the day, HUD is the one that will ultimately decide if a project is funded or not. So there's different things that go into HUD's decision, one of which is the amount of funding that they ultimately have available. There's other things that impact that decision, including our CoC's performance, overall, where we rank those projects. So there's a number of things that go into there, but just wanted to note that just because we make a decision locally to submit an application to HUD doesn't necessarily mean that HUD will ultimately select that project for funding. So I used this phrase just a moment ago, new and expansion. So I want to take a moment to really define what this means. This, again, particularly for those for whom this might be the first time you're considering applying. So throughout this presentation and throughout the RFP, you'll see this language, new projects and expansion projects. So here's what we mean by this. So new projects, those are projects that do not currently receive CoC funding in the Detroit CoC in particular. So it could be programming or projects that are already in existence, or it could be something that your agency is thinking of starting kind of from new. But regardless, these are projects that do not currently receive CoC funding. Expansion projects are projects that do currently receive CoC funding in Detroit and are requesting additional funding to add additional units or additional services to an existing project. For expansion projects, if that project is funded, HUD will issue one grant agreement that will combine both the current funding, which is the renewal grant, and the new funding into one grant agreement. So both new projects and expansion projects are funded using kind of the same pool of funding, either new project funding or reallocated funding, and both are considered new from both HUD's perspective and the CoC's perspective. So we kind of use the phrase new and expansion, but ultimately they're both considered new projects because in both instances, the applicant agency is requesting funding that they don't have right now. So they're requesting new funding. It's either funding to fund something new or to expand its new funding to expand what they currently do. So this little decision tree is maybe helpful for agencies to think through if the kind of project you're thinking of applying for is a new or an expansion project. Later on, when we get to looking at the online portal, this is going to become really important that you know what type of project you're applying for, because it's going to impact the questions you have to ask or answer in your application. So this is a pretty, hopefully, simple decision-making tree. You just kind of ask yourself, is the project that you're applying for currently receive CoC funding? If the answer is no, then obviously this is a new project application. You could be an agency that has other projects that receive funding, or maybe you've received CoC funding in the past, but really what we're talking about here is the current project that you're applying for, whether or not it currently receives CoC funding. On the other hand, if the project you're applying for does currently receive CoC funding, then you're going to kind of go down the other branch of that decision-making tree and determine, are you asking for additional funding for that project to either provide more units or provide additional services? And if yes, then that's considered an expansion project. So hopefully that kind of helps to clarify what's an expansion and what's new. So the evaluation criteria differs for new projects and expansion projects. There is a detailed evaluation criteria in the RFP. Sort of the last half of that document goes into quite a bit of detail on how all of our projects are going to be evaluated. Just wanting to note that for evaluation, the evaluation criteria for expansion projects, it's going to rely more heavily on past project performance, the performance of the project that you're seeking to expand. And so this is, because we want to make sure that we are funding projects that are performing well, meeting, again, kind of our local performance expectations. And so that past performance is going to be taken into consideration pretty heavily as we are evaluating those expansion projects. But again, for any application that you're going to be submitting, the detailed evaluation criteria, again, is in the RFP. We're not going to be able to go over all of those details in this webinar. So just ask that you review that so you have an idea of, again, what the review is going to be taking into consideration. So let's talk about the types of projects that agencies can apply for. So going to kind of go over these. Again, there's some more detail in the RFP about what these project types are. So what can be applied for? So permanent supportive housing, or PSH, we would be accepting applications for either what are called scattered site projects, which is where the clients are renting units kind of scattered throughout the CoC geography, or project-based projects. So project-based meaning the PSH units are all located in one particular building, one site. We would accept applications for either new or expansion PSH projects. We will also accept applications for new rapid rehousing programs. Rapid rehousing provides shorter-term rental assistance and supportive services. I should have mentioned permanent supportive housing is a long-term housing intervention for individuals that have significant barriers to housing. Rapid rehousing is a slightly less intense intervention. So again, we would consider new or expansion rapid rehousing programs. We will also be considering new or expansion rapid rehousing programs that are specifically targeted to people fleeing domestic violence. So these would be funded with our domestic violence bonus dollars. We'll also consider applications for what's called the joint component transitional housing rapid rehousing project type, either new or expansion. These applications, these projects, we are going to fund only with our domestic violence bonus dollars. So those projects do need to be targeted and to exclusively serve people who are fleeing domestic violence. This joint component project type combines transitional housing with rapid rehousing, with the really intent being that the transitional housing portion of the project provides an immediate, safe intervention, safe place for someone to stay while they then work to transition to the rapid rehousing component or to transition to other housing resources. I'm going to talk a little bit more about this joint component project type a little bit later on in the presentation as well. The other types of projects that we'll consider are new coordinated entry projects, again, either new or expansion, including coordinated entry projects that would be specifically targeted to people fleeing domestic violence. Again, I'll talk a little bit more about these coordinated entry projects in a few minutes. And then the last type of project application we'll consider is what's called a dedicated HMIS, a homeless management information system. This project type is limited to expansion only because the only eligible applicant for this type of project is the current HMIS lead agency, which is, and full disclosure, that is HAND. So the agency I work for, we have been designated by the CoC as the HMIS lead agency. As such, we currently receive this dedicated HMIS funding, and so we are the only eligible applicant to apply for a dedicated HMIS grant. Every individual project application may request their own HMIS budget line to support their own HMIS data entry work that they need to do. But in terms of the dedicated HMIS grant, the current HMIS lead agency is the only one eligible to apply. An organization may submit more than one application. There's no limit to how many applications you can submit. I would say if you're considering submitting more than one, just be mindful of if you were selected to have more than one submitted to HUD, and if HUD did fund more than one of your applications, just to be mindful of your own organizational capacity to implement and carry out multiple new projects at the same time. But there's no limit to how many an agency may apply for. And again, when we get to the online portal, you'll see that each application would need to be submitted separately via that online portal, just because there are different questions that will apply to different types of projects. So the types of projects that we are not able to fund, so this year, the CoC will not be funding that joint component project type, that transitional housing, rapid rehousing project type that's targeting any population other than people fleeing domestic violence. Again, we are going to be funding those projects just with our DV bonus money, so they do need to be targeted to people fleeing domestic violence. We also cannot fund standalone transitional housing, new standalone transitional housing projects. We are only able to fund renewals. We are not able to fund new safe haven projects or new standalone supportive services only projects that are not coordinated entry. We also cannot use CoC funding to fund emergency shelters or prevention projects. So if you were here thinking you may be able to get funding for some of those types of projects, unfortunately, we are just not. This is a CoC regulatory requirement. We are not able to use our funds to fund those last 5 bullet points that you see there. So the reference before, the amount of funding is currently unknown. Now that the NOFO is out, we hope to have that information solidified soon. We do have some estimates on how much we anticipate being available, but the exact amounts are not yet known. So what we do know is that there are 2 sources of new project funding and possibly a third source. So reallocated funding is the source of funding that may or may not ultimately be available. This is funding that would be taken from an existing CoC project and reallocated or repurposed for new project funding. Excuse me. We have an entire process that we're going through locally as we review and evaluate our renewal projects to determine if they will be reallocated. So no decisions have been made there on that end. So at this point, we don't know if there will be any reallocated funding available. If there was reallocated funding available, it would be combined with what we call our CoC bonus funding. This is really kind of the main pool of funding that HUD makes available, from which we can fund our permanent supportive housing, rapid rehousing, coordinated entry, the HMIS grants, those all come out of the CoC bonus. Lastly is the domestic violence bonus funding, which again is another source of funding that is used to fund projects specifically targeted to people fleeing domestic violence. So these next few charts are also in the RFP. This is just meant to give sort of a summary of the estimated amount of funding that we think will be available. So for the CoC bonus funding, we're anticipating between $1.5 and $1.7 million to be available for those new projects. Again, still kind of to be determined. And then here you also see the types of projects that we'll consider with those funds. So this is really just a sort of a repeating of the things that I have gone over before. We're going to get in a minute, a little bit later on, again, we'll talk a little bit more about the coordinated entry grant and why for CoC bonus, we're only considering expansion projects. That we'll touch on that in a moment. For domestic violence bonus funding, this is typically a bit of a larger pool of money. In the past, it's been usually between $2 to $2.5 million. So don't know if it'll be that much this year or not, but this is just our estimate. So you can again see here the three types of projects that we'll consider with the domestic violence bonus dollars. It's those rapid rehousing, that joint component, and a new coordinated entry. For all of these projects, we would consider either new applications or expansion applications. Just a note too that for agencies that have a non-DV rapid rehousing program, CoC funded rapid rehousing program, that those projects can be expanded using domestic violence bonus dollars to add DV units to kind of that portion of your general rapid rehousing project. So if you're a current CoC rapid rehousing recipient and you have some more questions about that, I'm happy to talk through that some more. Okay, I want to touch bases a little bit. I've alluded to this a little before regarding the CoC bonus dollars and this the new coordinated entry grant. So some sort of quick background to this. You may be aware that we are undergoing a transition with our coordinated entry lead agency. This has been a transition that's been in the process for almost a year now. The Southwest Counseling Solutions, which has historically served as the CoC lead agency, will be relinquishing that role as of September 1st. So since about September of last year, we've been planning to identify a new CoC, a new coordinated entry or CAM lead agency. So during that planning process, really at the beginning of this year, we started doing some scoping out of some budgeting and some needs and really trying to determine what would it take financially for us to have a coordinated entry process that is functioning in a way that is providing the highest quality of services that we would want to people experiencing homelessness. What would that take, from a financial perspective? Through the course of that work, it became clear that there was a gap in funding. And so then we started conversations around how do we close that gap in funding? So we had conversations with the city of Detroit, with the VA, with other funding partners. And it was also recognized that the CoC really could be asked to put in additional CoC funding to support coordinated entry. So through those conversations, a recommendation was made to the CoC board, which they subsequently approved, that in this year's competition, the CoC set aside $350,000 in CoC bonus funding for a new coordinated entry project. So of that CoC bonus pool that I referenced earlier, which we think is going to be about $1.5, $1.7 million, we're going to take $350,000 kind of off the top of that and apply to HUD for a new coordinated entry grant with those funds without having to compete locally for it. So the project that will be submitted to HUD by the new CAM lead agency, again, without having to apply first via the local application process. So again, in full transparency, HAND has been designated as the new CAM lead agency. So HAND will be the applicant that will be applying for this new $350,000 coordinated entry funds. Just to also sort of make it clear, the decision on the decision to set aside this bonus funding was really made prior to the final decision on who would be the new CAM lead agency. We had, certainly some kind of overlapping timelines, but they were, conversations and decisions that were taking place sort of like in sort of parallel processes. So if anyone wants more information on kind of the timeline and how those decisions were made, happy to go into that. But just wanted to, kind of be transparent about that as well. Also, over the course of the coming weeks, HAND will be working closely with the CAM transition team, other partners involved with this transition on the best use of these $350,000, really having those conversations around what's going to be the best use of these dollars, what types of staffing do we need, how do we want to use this to close our funding gap. So those conversations will be really starting in earnest in the coming weeks. So for any individual project application that's submitted, there's no limit to how much funding you may request. Every application is limited to just a one-year grant, or excuse me, a one-year grant term request. So whatever is being requested would be for 1 year. After that 1 year, projects are typically eligible to be renewed for subsequent 1 year terms. But just know there's no limit to how much you as an applicant agency may request. There's no upper limit or lower limit. I would just say, be mindful of the total amount of funding that we've indicated we have available. Be mindful of the amount of funding that you feel your agency can manage. There are match requirements to these funds as well. So however much you request, there's for the most part, there's going to be a 25% match. So you're not going to want to request more than what you're going to be able to show match for. In terms of when projects would start, projects that are funded. So once HUD, as I kind of referenced before, that timeline, we make a decision locally, we then submit those projects to HUD. That submission to HUD will happen by the end of September. We then anticipate HUD making funding announcements in the early part of 2024. And then for new projects that are funded, the estimated start date is in the latter part of 2024. So probably the fourth quarter of, really over a year from now. Projects that are funded as an expansion project, the start date will be the same date as your current project, because again, HUD is going to take that expansion funding and just combine it with your current project funding. So you'll receive just that one grant agreement, and you'll have that start date will be the same as what your current project start date is. For agencies that are considering applying for permanent supportive housing funding, whether new project funding or expansion projects, this is the policy we've had in place for a couple of years, that PSH projects may apply for supportive services only. For a number of years ago, PSH projects had to apply for both new units as well as services, in recognition that some of our PSH projects could really use some additional supportive services funding to help overall improve their programming. PSH projects may apply just for supportive services only. Again, that could be if you're an existing PSH project and you want to add or expand on your services budget line, or if you're applying for PSH funding for the first time, you may request just supportive services. So something that is new in our local application process this year is questions and evaluation criteria around leveraging healthcare and housing resources. So this particularly, it really only applies to housing projects. So PSH, rapid rehousing, or the joint component housing projects. There's again questions in the application on a project's ability to leverage healthcare and non-CoC funded housing resources. And to the extent that you are able to document that you're leveraging those other resources, that will be included in the application as well. So where this comes from is really as part of our local goal to identify how projects are able to leverage healthcare or other housing resources to help improve and expand on the availability of housing and healthcare for people who are served in those programs. This ties to a scored component of the CoC application. So just kind of briefly, the CoC application is an overall application that we also submit to HUD. In addition to all of the individual project applications, we submit an overall CoC application. And that application is what HUD evaluates and scores us on as a CoC, which determines the amount of funding that we receive. One of the things that HUD scores us on as a CoC is the extent to which we're able to demonstrate new projects that are being submitted that are able to leverage healthcare and housing resources. This really started in the 2021 competition. I think largely, with the pandemic, just really recognizing the connection between housing and healthcare. So really wanting to emphasize that. And so HUD has really started to make that a priority in their funding strategies. And so we are kind of taking that priority that HUD has placed on the CoC as a whole, and then tying that to our local application process. So what do we mean when we say leveraging other non-CoC housing resources? That could really include any other type of subsidy or subsidized units that are funded by really essentially anything that's not CoC funding or ESG funding. So that could, you kind of see the list there, but that could include projects that receive low-income housing tax credits, project-based vouchers, really any other kind of housing subsidy. The way that we have, again, demonstrated this to HUD in the past is when we have submitted an application for PSH project that had tax credits attached to it. The demonstration of those tax credits was our way of demonstrating the other housing subsidies that we were leveraging to that project. So that is just kind of an example of what is meant by non-CoC housing resources. The healthcare leverage, kind of what is meant by that is maybe a little, I don't want to say open-ended, but one of the probably main ways to be able to demonstrate this would be if your agency is able to bill an insurance for any of the services that are provided, whether that be public or private health insurance or Medicaid reimbursement. I know there's a number of agencies that are able to demonstrate that. If you are able to, if the programming receives healthcare services that are provided by a private or public organization, and you're able to document that, that would also be considering leveraging housing or healthcare resources. I'm going to pause there just for a moment to see if there's any initial questions that I can answer. Okay. Don't see any questions or any hands, so we'll keep going. So I want to walk through a little bit of our local funding priorities. So we anticipate receiving more applications than what we'll have sufficient funding to fund, particularly when it comes to the CoC bonus funding. That is the smaller of the two pots of funding that we have. Again, we have between $1.5 and $1.7 million. So when we think through the applications we'll be receiving, and particularly those that, as we review them and evaluate them, that we would say, yes, we want to move these forward, we want to submit them to HUD, we'll probably have more projects than we have funding available. So we have laid out some really kind of an order of priority and how we will allocate the funding that we have to the CoC bonus projects. So I'm going to kind of walk through this just to help you, give a sense of once we get those applications in, they've all been reviewed, we know which ones we want to move forward. How are we then going to essentially assign dollars to those applications with the amount of funding that we have? So the first priority would be to fund new or expansion PSH projects that are requesting funding for additional units. And we say that with a goal of funding at least 40 units. That goal can be yeah, it's a bit flexible, but we wanted to have at least a goal number there. So essentially this is saying, well, those are the types of projects that we would first allocate that funding to. I should have also said, I'm sorry, even before this first one, these funding priorities are all after we have kind of done that $350,000 set aside for that new coordinated entry grant. So again, that one's kind of coming off the top. But after that, then we would fund PSH projects that are bringing new units to the table. This is based on our desire to increase unit capacity, unit availability for permanent supportive housing. And then if funding remains, we would fund PSH projects that are requesting funding for supportive services only. So again, wanting to prioritize permanent supportive housing. Then if we have funding left, again, if there's any remaining permanent supportive housing projects after we've kind of hit that 40 unit goal, and we funded, ones with supportive services only, then if there's, again, any PSH projects remaining, we would allocate funding to them. Then if there's funding remaining, we would fund new or expansion rapid rehousing projects. If there's funds after that, we would fund the expansion dedicated HMIS. And then lastly, if there's funds remaining, any additional expansion coordinated entry projects that may be submitted, again, other than that set aside project. So that just gives you kind of an idea of the order of our funding priorities. And as you can see, we really are prioritizing permanent supportive housing. This really aligns with our CoC's desire and goal to reduce the number of people who are experiencing chronic homelessness. For our domestic violence bonus funding pool, there's a similar strategy here. So our first priority would be to fund a new or expansion rapid rehousing with that DV bonus funding. Then again, if funding remains, new or expansion joint component projects. And then lastly, new or expansion coordinated entry projects. Typically, because that DV bonus pool of money is usually about $2 million or more dollars, we typically find that we do have sufficient funding to give an allocation to all of the projects that are submitted that are evaluated favorably. Nevertheless, in the event that we have more quality applications than what we have funding to allocate to it, this is the order of priority that we would use for that DV bonus funding. I'm going to pause for just a moment. I see there's a question in the chat. Can a new PSH project that's likely to start in the first or second quarter of 2025 based on completion of rehab apply? Yes, you may certainly apply. For PSH projects that have a rehab component to it, a couple of things. One, we are not using our CoC dollars to fund rehab costs. So acquisition, new construction, rehab, those funds need to be found elsewhere. For these types of projects, there are specific questions in the project application for, again, PSH projects that would be a project-based or a site-based project that are undergoing rehab that will ask questions around the timeline for that rehab, other sources of funding that are being used to fund it. So there's questions that will dive into that. And then that information will be used as we're evaluating the projects to determine if this would be a good use of our funds to put an allocation of CoC funding towards them. All right. So the target population. So who can you serve in these projects that we're talking about? So we're going to kind of run through this. So for permanent supportive housing projects, I referenced earlier that part of the reason why we are prioritizing permanent supportive housing is part of our strategy to reduce the number of people who are experiencing chronic homelessness. So people who are experiencing chronic homelessness, which means they have a disabling condition and they have a long term of being homeless. There's more specifics to that definition, but in a nutshell, that's what it means. Based on our local priorities, are typically prioritized first for our permanent supportive housing units. We have made a change here locally in the past couple of years to align with kind of a flexibility that HUD has given us in that all of our new PSH projects will need to be what are called dedicated plus projects. So they would need to serve people who would fit that definition of dedicated plus, which does include people who are experiencing chronic homelessness. So it's a bit of a convoluted definition. It is given in the RFP, so I would, recommend that you review it there. The other thing to keep in mind is that all projects will be required to take referrals through our coordinated entry process and through who we prioritize through coordinated entry, which for PSH right now is really typically people who are experiencing chronic homelessness. So just know that that is the target population for PSH. One thing that, excuse me, tickle in my throat. One thing that a change that we have made this year locally is that we would consider permanent PSH projects that may be targeted to either single individuals or families. Historically, we have limited new PSH projects to just be targeted to single individuals based on the need data that we've seen. We've started to, unfortunately, seen an increase in families who may be assessed as needing permanent supportive housing. So we're opening that up a bit, and we would consider PSH projects that could be targeted to either singles or families. What we will not consider are projects that are exclusively targeted to youth, which are ages 18 to 24. Those individuals may still be served kind of in the general PSH because they are, adults, so they may still qualify. We are just not going to consider in this funding round PSH exclusively targeted to that population. We do have a new youth homelessness demonstration program that is PSH getting off the ground that is specifically targeted to that age range. And so I think we're hoping to get some lessons learned from that project before we really kind of open that up even more. For rapid rehousing projects, who's to be served? Again, that would be individuals or families who are either category 1 or category 4. It's a little bit more open-ended. Those categories, those definitions of homelessness are, again, given in the RFP. And obviously, if you are applying with a domestic violence bonus funding, your rapid rehousing project must exclusively serve people fleeing domestic violence. Again, rapid rehousing projects that are exclusively targeted to youth will not be considered. Again, we have we have a youth joint component project that's just getting off the ground as well. So kind of same thing for that joint component project in terms of the eligible populations. For the coordinated entry project, so any coordinated entry projects funded with the DV bonus, again, must be targeted to people fleeing domestic violence. Any coordinated entry project that's funded with the CoC bonus, that is much more broad, and really the intent of those programs are to serve people who are accessing the coordinated entry system. So it's a little bit broader there. So again, the RFP goes into a little bit more detail on these target populations. And so in terms of agencies who are eligible to apply. So HUD has laid out some pretty basic eligibility criteria. You need to be a nonprofit organization, unit of state or local government, or public housing agency. Any agencies that apply that do currently receive CoC funding do need to be in what's called good standing with HUD. So, we get applicants from any of our applications from any of our current CoC recipients. We might, just go to HUD just to make sure that they're in good standing. We have never had an issue with that, but just wanted to make a note of that. The CoC this year, again, has, particularly for our coordinated entry projects, has put some additional eligibility criteria that I want to touch on. So for the CoC bonus coordinated entry applications, the decision was made that the eligible applicants for those coordinated entry CoC bonus projects would be limited to the current coordinated entry recipients only, which would, and we have two of those recipients. One is community and home supports. They currently receive coordinated entry funding to provide navigation services. So they would be eligible to apply for additional CoC bonus coordinated entry funding. And then the other current recipient, again, will be HAND as the new lead agency. So we would be eligible to apply for additional would be eligible to apply for additional coordinated entry funding in addition to that set aside funds that I've already referenced, should that decision be made to do so. For coordinated entry grants that would be funded through the DV bonus pool of funding, any eligible applicant may apply. So any applicant that meets one of these 3 eligibility criteria up above may apply for that DV coordinated entry funding. And then I've already talked earlier about the eligibility for the new dedicated HMIS grant. So we've talked about coordinated entry. We've used that phrase a number of times. So touching briefly on this. So all projects that are funded with CoC funding must take their referrals and fill their units only through our coordinated entry process. Locally in Detroit, that's known as CAM. So this is a regulatory requirement that referrals to your projects, if you are funded, they will be made in accordance with our community's local prioritization factors. Really, the goal of coordinated entry is to ensure that our CoC resources are targeted to people most in need of housing and the services available. It's a way for us to, again, really make sure that these limited resources that we have are being prioritized and being targeted. If your agency does receive CoC funding and coordinated entry is all new to you, you've never interacted with CAM before, maybe you've never taken referrals from CAM before, we will provide a lot of additional training and orientation to how coordinated entry works and particularly what this would mean for your project. So just, again, if this is all new to you, there would be more training to come. I'm going to talk a bit about some general requirements for all of our project types, and then we're going to go into some more specific requirements for the individual project type. So again, this is all given in greater detail in the RFP as well. So some overall general requirements: we expect projects to adhere to housing first. There's a lot of information in the RFP about what we mean by that, but essentially lowering barriers to housing and services, not making the receipt of housing dependent upon the person's participation in services. We expect adherence to any CoC written standards or written policies and procedures. Again, the RFP provides some links to those documents. You have to be compliant with all of HUD's regulations. That's sort of a given. I should have said that first. But all of HUD's regulations, that's going to be a requirement. HUD will monitor you as a recipient on your compliance with their regulations. Part of that also is being able to demonstrate that you meet the 25% match requirements, which when we get to the budget spreadsheets, I'll talk a little bit more about match as well. Compliance with HMIS is required. If you are funded, there will be pretty extensive training on use of HMIS. We expect and would like to see that if you're funded, you are able to enroll your first program participant within 3 months of receiving that grant agreement from HUD, or within 3 months following the completion of rehab. Again, if this project has rehab attached to it. There's certain environmental review requirements that need to be adhered to, which again, we assist with some of that. And lastly, there is an assessment fee that is levied against to agencies receiving these funds. It's 0.75% of the amount of funding that you receive, does need to be paid to the CoC lead agency to support our infrastructure, our role as the CoC lead agency. So again, those details are in the RFP. So some additional requirements for the individual project types. So for permanent supportive housing, this year, as in past years, we are not considering SROs or single room occupancies. This is based on just some historical data, what we've looked at and what we've seen through coordinated entry, that people who are referred to SROs typically decline those referrals, which is telling us that the people that we're serving prefer a non-SRO type of housing arrangement. So that this is a decision that or it's a policy that we've had in place for a couple of years and that we have again this year. Some of this I've already referenced before in terms of who these projects need to be targeted to. For all projects, you are limited to requesting just a one-year budget. And then again, after that first year, the project is likely to be eligible for renewal for subsequent years. It would be pretty unlikely if it was not eligible for renewal in subsequent years. Again, projects for PSH could be either scattered site or project-based. Project-based projects in their application do need to provide evidence that there is either a deed or a long-term lease agreement or some type of site control for the location where that project is located. I touched on this briefly, but again, project-based projects, there's a number of questions that are going to go into detail about other funding that either has been applied for or awarded to that project, like tax credits. If you applied for tax credits, 4% or 9%, in what round? So there's a number of kind of questions, or maybe one application that's going to get into some of that. This information is really helpful for us on the review side to understand some of the timings of when tax credits have been applied for, if they've been awarded or not. The timing, aligning the timing of all of these funding sources can be really tricky. And so we want to make sure at the end of the day that we are allocating our CoC funds to projects in which the timing is going to work out as smoothly as possible. So you'll see some questions around that application around tax credits. Again, this only applies to project-based PSH. Rapid rehousing projects, really have touched on this as well. Rapid rehousing is limited to providing tenant-based rental assistance, do need to serve, again, the target population, people who are category 1 or 4. Domestic violence projects, that's particularly going to be targeted to people who are category 4. Rapid rehousing projects do have a regulatory requirement to provide at least a monthly case management. That is part of HUD's expectations and HUD's requirements for rapid rehousing. The joint component, transitional housing, rapid rehousing project. I think the biggest thing I want to point out here in terms of the requirements for this project type, this kind of points 3 and 4. The agency who's applying must demonstrate an ability to provide both transitional housing and rapid rehousing. That could be done through a partnership, as particularly like a subrecipient agreement. If one agency, the recipient, holds the funds and they have a partner, a subrecipient partner that would do either the TH portion or the rapid rehousing portion. But the point being that we are not able to fund with this joint component project type just standalone transitional housing or just standalone rapid rehousing, because that would just be a rapid rehousing project. These applications must also demonstrate at least twice as much rapid rehousing capacity as transitional housing capacity. So again, the really intent behind these projects is that it is not funding their typical transitional housing. The transitional housing portion is intended to be relatively short-term stays to meet that immediate need for safe housing while you ultimately transition that person off into rapid rehousing or another type of housing resource. So because of that, HUD really expects there to be twice as much rapid rehousing capacity, which you would demonstrate in your budget request in the number of units that you say you're going to provide as rapid rehousing. So requirements for a coordinated entry grant. So a couple of things that are particular importance for new coordinated entry grants. One is that there is a letter of support that must be submitted with your application from the CAM governance committee. I will show that template for that letter when we get to it, and there's a timeline in the RFP on when that first that request needs to be submitted to me, and then it's forwarded on to the CAM governance committee. But if you're considering applying for coordinated entry funding, either the domestic violence bonus or the CoC bonus, just make note that this is going to be an additional piece of your process. Also, there is a limit to, or some, I guess you could say, boundaries in terms of the types of activities that these new projects can request. They're limited to access point activities and navigation activities. If you as an applicant feel like there are other activities that within coordinated entry that would are a gap or a need in our system, you may include that in your application. You would need to provide data, provide rationale for how those activities would fill a gap in coordinated entry. And then again, your response to that question would be taken into consideration during the project review process.